So, good morning, everyone. I'm Dr. Sebastian Torres, plastic and maxillofacial surgeon from Italy and Chile. Actually, I'm working in Santiago, so I'm giving this webinar for you about cell booster combination protocols from Santiago. So before we start, they asked me to tell all the attendants that you can ask all the questions through the questionnaire section, okay, not in the chat, but in the section of the questions and answers. And we will be answering the questions during the webinar and after the webinar as well, okay? And the other thing that they asked me is to follow CELL.pro in the social media, so we make a bigger and stronger family, okay? So the topic, today's topic is a topic very new, very innovative, and I think you will appreciate it and you will like it because it's the combination between cell boosters and many other things, okay? We will be discussing one by one, so feel free to interrupt or send your questions to the question and answer section. So when we talk about combinations, we mean combinations between these cell booster products to combine the different types of cell boosters that we have, and to combine the cell boosters as well with other products like fillers, like other biostimulations, like platelet-rich plasma, other devices like radiofrequency or other procedures, including surgery. So we will be discussing a little bit about each one of those. So the concept of cell boosters, you know, is a physically stabilized, long-lasting hyaluronic acid with multiple active principles for true rejuvenation. That's the main difference between our product and all the other products that are present in the market. You know, it's the first one has been physically stabilized, so it has very novel and very technological concepts. So the technology of this CHAC structure is that, as I told you in different congresses, the molecule of hyaluronic acid is stretched. Once it gets stretched, there are some slides, some slots that get open within the hyaluronic acid molecule, and you are able to place some active ingredients within these slots, and then you can release this tension, and the molecules unfolds once again, over its same structure, and you get a very tight and uniform structure of hyaluronic acid that is intelligent because it has new active principles within this molecule. That's why we get three different conditions. The first one is we have no binding chemical agents. We have no BDDE, but it's a stabilized molecule. We have a physical stabilization procedure. That is the first one to be invented in the world. And we have a slow release of active ingredients. So we will have a retard action, a long-lasting action of these active ingredients. And the other thing is that there is a unique ingredients combination, and obviously Swiss technology. So the line, as you know, we have four components: lift, glow, hair, and shape. And we will be developing and discussing each of the product's characteristics. So when we are speaking about cell booster lift, we know that is a product that is intended to diminish aging of the skin. We feel a little bit the soft tissues, but it's not quite a filler. We will prevent oxidative stress. We will prevent dehydration because this product is specifically focused on enhanced collagen production and cell nutrition. So it will redensify the skin, and it will lift the tissues in a very effective manner, as you will see in the pictures. And as well, it will improve the microcirculation and the skin tone. So obviously the main indication for this product is the loss of firmness in facial tissues, the irradiated skin, wrinkles. Even though it's not a filler, none of the cell boosters components are truly a filling agent, but it has a hyaluronic acid within it, so you can still feel superficial lines and superficial wrinkles. is intended for skin laxity, loss of skin tone, and cuperosis as well. I have been having very good results with cuperosis in my patients. So the main component of all this line is hyaluronic acid, obviously 18 milligrams, and then you have a pool of amino acids such as arginine, glycine, lysine, proline, and valine, and vitamins like B2, vitamin C, and vitamin E. That truly makes a difference when you are injecting, because it's not just taking a pill and you have 1 day of action, because these products are stabilized for at least 15 to 20 days. So you will have, for each session, you will have at least 15 days of benefits after the session. So you truly are healing the skin from the inside, and the patients are able to tell the difference between this product and other products they have tested before. So the other product that we will discuss today is Glow, CELLBOOSTER Glow. It is intended more for nourishment of the skin and to reduce the hyperpigmentation. Whenever you have pigmentation problems in the skin, whenever you have some sort of unevenness of the skin tone, whenever you have melasma, whenever you have even acromia, like vitiligo, you can still use Glow and have excellent results. I get better results with this product in younger patients, especially when you don't quite need a lifting in the skin. So the main indication of this product is hyperpigmentation, incipient aging. So I tend to use it in younger patients, dry skin. It's very good to build the skin up, to improve the skin before the summertime, or to pump it up to some sort of stimulate the skin before applying some sort of procedure that would be minimum invasive or medium invasive, because the skin will be some sort of enhanced and it will heal faster after the application of the other technologies that we will see. Obviously, you can still apply it in sun damage and environment compromised skin or uneven skin tone. Main indication here is hyperpigmentation and young skin problems of dry skin. So the components as well here, hyaluronic acid, and the pool of amino acids a little bit different. We have glutathione and we have glycine and lysine, which are in involved in the pigmentation production, okay, or in the pigmentation process. And vitamins such as vitamin C, which also we know that they have a function in the evenness of skin tone. So this product we don't tend to not to speak as much in the congresses presentations, but it's one of the main and better products of the line, which is CELLBOOSTER Hair, especially designed for strengthening hair follicles, improving hair circulation and hair growth, and it will restore the fiber of the hair. I have been seeing very unexpected result with this product because it truly works as much as a platelet-rich plasma, so it will improve hair growth by at least 80%. Okay, and the other thing that has impressed me is that sometimes you prevent hair loss, you prevent the graying of the skin, and even we have seen a repigmentation of the hair, which is something that I don't understand why, but we have seen that hair that is turning into gray sometimes restores the color once again, which is a very unique characteristic of this product, and it's one of the reasons why our patients like it so much. So the indications from this product is obviously alopecia, non-cicatricial alopecia, androgenic alopecia that is very common in population, and any damage in hair shafts, such as dull color or split ends, premature graying, and seborrhea. Also, we have seen some benefits, in the scalp skin. So whenever you have the seborrheic dermatitis or this scaling condition of the scalp, we have seen a regression of these conditions through the application of CELLBOOSTER Hair. So this product is supposed to stimulate hair growth, but it makes so much different other things over the scalp and over the hair as well. So it makes the hair go thicker, stronger. You see a lot of more density, and you reduce the hair loss in men and women. So it's very good because it delivers all the key active ingredients for that are necessary for hair growth, such as niacin, rutin, biotin, and there are all these B12, B5 components that we usually take the prescriptions orally, but the bioavailability in the local space of the scalp is very reduced. So with this punctures, with this serial treatments over the scalp, you enhance the results and you get very, very long lasting and good results, even combined with hair transplantation or not. So the other products that I really like is Cell Booster Shape, because it has a very wide variety of applications. You can apply it in the face, you can apply it in the body. And the main thing here is local fat reduction, and a lot of it affects, it improves water retention because it improves microcirculation. So it is intended for all the so for all the local fat accumulation that you want to get rid of. It could be double chin, it could be the visceral fat part. We have presented that as well. It could be, you know, the lower backs of the eyelids. It could be as well inner thighs, abdomen, and so forth. The handle love, the love handles, and so forth. It's very good as well for cellulitis. So the principal indication would be local fat accumulation and double chin, fat cheeks, cellulite, water retention, puffiness, and edema. It's very important that you understand that this is something that works with no inflammation. It doesn't act like phosphatidylcholine or also the oxalic acid because it induces the cells to go on apoptotic death. So it has no inflammation related. It's not painful to be injected, such as in contrast with phosphatidylcholine. So it's a very novel and very good tolerated procedure to be delivering for our patients. Okay, it has L-carnitine, it has vitamin C and hyaluronic acid, and we have seen very good results in the face and the body. Obviously, it's related to the physical activity as well, because vitamin C enhances, fat reduction by 30% when you actually perform a physical exercise. So it's very important that the patients understand that it has to be combined with some sort of exercise. So to get into matter that we have that we are related today, or we have been called today to speak about, we will speak about full face cell booster combination. So here you have all the products that are present in the line: Cell Booster Lift, Cell Booster Hair, Cell Booster Shape, and Cell Booster Glow. And with these circles, I want to show you the difference in the applications of where we apply mainly our products. So Cell Booster Hair, obviously, we will be applying it all over the scalp in the areas that we want to enhance hair growth. And on the other side, Cell Booster Glow, we can apply it pretty much anywhere in the face and neck and the dorsum of the hands. And it's the more versatile products because we can apply it pretty much everywhere with so many different techniques. The other product is Cell Booster Lift. In Cell Booster Lift, we can apply it in the upper third, middle third, or lower third of the face to enhance the lifting of the tissues and to favor skin retraction and neocollagen growth. And Shape, we will inject it mainly in the areas when we want to get rid of fat. So in the face and the neck would be much more in the double chin area, in the visceral fat area, and in the lower lid backs, fat backs. Okay, that's main indication for me, and it's very good. We have had good results alone with this or in combination with other technologies. So the delivery technique of the cell boosters, obviously, if you are injecting Cell Booster Glow or hair, we want micropapules. We want to deliver our products as widely as possible, and it's very tolerable for a patient if you use very thin needles like 32 gauge mesotherapy needles. You have to understand that these products are not viscous at all, so they're not feelers, okay? They're very liquid, so they can be delivered through very thin needles, or they can be delivered through thicker needles or cannulas, up to you, okay? They're very versatile in their use. Whenever we're using cell booster shape, we want to melt the fat. Also, obviously, we will favor a bolus, some sort of balloon in the area of the main fat deposit to enhance the result, to enhance the action over these fat compartments, okay? The other thing is the cell booster lift. When we want to do some lifting of the tissues, we have to understand that the lifting procedures, surgical lifting procedures, are done with incisions here, and the vector of retraction is like this, or like this, or like this. So we tend to emulate the same surgical action through the application of this product, mainly with cannulas. Of course, you can inject it with needles, but I prefer the cannula because it does some undermining in the skin, and you release the product in a retrogradal linear technique. So by undermining the tissues, you are removing the attachment of the skin, and you are favoring that the product can retract the skin in a much more efficient way, as I will show you in the pictures. So as I told you, you can use needles, you can use cannulas. I use my preference for lift is a cannula, and I use the other products with needles. So what are the advantages of having a combination between cell boosters? So the main advantage is you will have faster results. Okay, nowadays, the people, especially because of the pandemics and all the video meetings, Zoom and conference, all the people are very interested in getting fast results to get themselves looking good in the screen. So this is a very important topic for patients. They don't have the patience anymore. They want to look very well yesterday, not today. So you have to be able to deliver very fast results, okay? The other important thing is that you can have global rejuvenation, because you will be enhancing and improving the skin tone, the skin pigmentation, and the skin hydration. And the other thing that you have to understand is that you can prepare the skin for further trauma or further skin damage before a vacation that goes to the Caribbean, and the patient is going to sand bath. So it totally protects your skin, or build some skin protection for an injury that will be exposed in the future. So it's very important, this advantages for cell booster combinations. Of course, you also have disadvantages. What will be the disadvantages? Obviously, if you are using more product, then you will have higher cost associated with the treatment. And the other thing is that the more the punctures, the higher the tolerability of the patient has to be. Sometimes, you know that there are certain patients that they tolerate 15, 20 shots in the face, and then you're done. So if you are delivering 2, 3, or 4 vials in one session, at some point the patient it will tell you, maybe the results are excellent, but my limit is up to here. Unless you do it with sedation or other things that we are not really, it's not really common that you would use sedation or other things just to do cell booster, okay? And the other thing is the availability. You have to be able to have all these products available, because we tend to buy, at least in my practice, we tend to buy a certain amount of cell boosters of each type, or fillers of each type. And you know that depending on the time of the year, you get more consumption of one product and less consumption of the other one, and you tend to be lacking some of the products of the line. You cannot deliver all in one time. So the protocols are very varied when you get to combinations. In my personal point of view, I like to put 3 vials or 4 vials of each product total, okay? And this can be divided in 2 or 3 sessions, up to your type of patients. I tend to believe that the less sessions, it's better, okay? Because the patients, they trust in waiting less time and getting faster results. but it's up to you. You can totally, this is a very good product to maintain the patients coming back and back again to your practice because they see the results. It's not as expensive, and you know, they will be healing the skin from the inside. You know, the patients really like this concept that these products are curative. They're not like camouflage, like botulinum toxin or other things. This is curative. This is something that will reverse skin aging, and it will make your face look so much better. So here we have a combination. We put 4 vials, 2 vials of cell booster shape, 1 in the Bichat fat pad, 1 in the neck, in the double chin. So it's 2 cell booster shape, it's 1 cell booster leaf and 1 cell booster glow. And we see an overall improvement of the face. We see, you know, that the neck is tighter, that the fat in the neck is a little bit is less. You know, we see that the dark spot in the cheek has been getting a little bit better. This is only 1 session, okay? So obviously you need more sessions for skin pigmentation, and you get some sort of lifting all over the mandible angle and definition of the cheek or zygoma, and depression of the buccal fat pad. So we got a very nice result. You know, the face looks smaller, looks shorter, and she looks a little bit slimmer, and she's so much happy with this result. And this was done in only 1 session. It's totally something that you can achieve and you can promote. Okay, so I prepare a video from you about Cell Booster Glow, mainly to focus in the variability of the type of treatment that you can do. Okay, you can put this glow all over the face. You can put it with 31 gauge needles, 32 mesotherapy needles, 26 gauge needle like a filler to treat regularly wrinkles, even though we know that this is not quite a filler agent. But I think you will like this thing. So it's very short. Frontal application with 31 gauge, mesotherapy needles, 32, around the eye contour. This is a filler sort of application. This is a 26 gauge needle. So like that, you can see that the products are they allow you to create. They allow you to develop plasticity, mental plasticity. You can do anything you want with this product because they have a low viscosity, but they truly can be used, especially I like glow for the crow's feet area, in the periorbital area. I like the glow to feel the fine wrinkles of the forehead, and still they do some sort of benefit in the deep wrinkles. Obviously, if you combine them with fillers, you can have a better result. So we will talk right now about the filler combination or cell booster combination with fillers, okay? And we have 3 concepts when we are combining with fillers. And the first concept would be to fill and rejuvenate. So we will use a filler to fill the wrinkles such as nasolabial fold, labiomental fold, mental fold. So we will use the fillers to fill, okay? And we will rejuvenate the entire face, superficial wrinkles, crow feet, frontal, as you saw in the video, with Cell Booster Glow. So by combining them, you get an overall rejuvenation of the face. You expand, you know, the wrinkles. You expand somehow the shadows, and you will be rejuvenating the entire face by the application of Cell Booster Glow. This is a case of a lot of sun damage, you know, photo aging. She has so many wrinkles in the face, and so we did a treatment with hyaluronic acid, and it doesn't look any better. I mean, it just look a little bit better, minor improvements. So this is a perfect case where you know that the filler is not enough, and you will have to promote some sort of skin rejuvenation with Cell Booster Glow to get a better skin tone, skin pigmentation and rejuvenation of all these lines around, like the perioral aging that she has to be able to deliver a better result. The other concept is when we want to enhance the volumes, okay? When we are combining fillers and cell boosters, we know that the fillers are used mainly to enhance the volume of zygoma, of the lips, or the chins. But by using the concept of shadows and lights, we can totally augment the light by enhancing the volume with a filler, and we can enhance the shadow by reversing the volume or affecting the fat compartments in the face through cell booster shape, in the V-shaped fat pad, in the double chin area, or in the neck. So as you can see in these pictures, when we want to enhance the volume of the cheek or zygomatic bone with a filler, and then we apply cell booster shape in the V-shaped fat pad, we get some sort of incavation in the buccal area that will enhance the S shape of the external outline of the face on 3/4 view. Okay, this is something that patients really like, because they make the face look slimmer, and it will enhance the volume because you will be not augmenting more the volume, but would be augmenting the degree of difference between the external and internal shape of this line. You can also do this in the cervicomental angle. Okay, here we have put a lot of volume in the chin area, so we will expand the lower third of the face, and we will be augmenting, the anterior posterior dimension of the face, and we will be injecting cell booster shape in the chin area, in the neck area, in the double chin. So the neck will go backwards, and the chin will go in an advanced position. So the difference between chin and neck will be much more. And you can totally tell the difference here, because you pass between 180 degree of cervicomental angle, almost no cervicomental angle, to almost 90 degrees, I would say maybe 100 degrees of cervicomental angle. So you can totally tell the difference between one and another by combining, fillers with cell boosters. So the other concept, it would be lift all over. When we want to enhance the lifting of the tissues, obviously we may be applying the fillers in the areas that we know for the anatomical studies of my friend Kotofama, but there are areas in the face that they cannot fall. They're not affected by gravity, mainly the preauricular area and the temporal area. So when we feel the temporal area or the preauricular area, we know that the face will just, go upwards because they cannot go down. But you can also experiment the lifting with fillers when you feel the eyebrow, or you feel the zygoma, or you feel the folds, minor lifting concepts. And you can apply a cell booster lift in the upper, the middle, or the lower face to enhance this result. If we are trying to apply, volume in the temporal region, and then we will apply, for example, cell booster lift in this area, this triangle, and the superior part of the face, obviously everything is going to move up, because we will have the tension of the filler, and we have neo collagen growth in this region, so everything will go up. Here you can see a very interesting case about the combination of these procedures, about being a bit with the zygoma and lifting with this product, and the eyebrow goes in a superior position. The cheek goes upwards as well, and you have a total different definition of the mandibular border here. So you can have very natural results, long-lasting results, and tangible results with these procedures. Nevertheless, they're really like non-invasive at all. So obviously, if you are combining fillers with cell boosters, you know that the fillers are applied more or less once a year, unless we're talking about fat grafting, which is just once or twice in a year, in a lifetime. But when we are talking about cell boosters, obviously, you know that the results with cell boosters are built in time, and you need 3 or 4 vials necessary total that are distributed in 2 to 3 sessions in time. So they asked me to talk a little bit about difficult areas such as the periorbital area. You know that this is a tricky part of the face because of many reasons. And so we are not really sure what to do sometimes when the patient complains about anesthetism in this area. So the main problems is that we have that we may have is that maybe we have some hollowing in this area in the nasojugal groove or the teardrop deformity. And obviously, if we have some hollowing or lack of volume, we will like to fill this. And if the hollowing is very minor, we can use some boosters, low. But if we know that we are really lacking volume, we have to use a filler. Okay. When we are talking about dark circles around the eyes, hyperpigmentation, or pigmentation disorders, we know that the glow is going to make a difference, going to improve, it's going to make a benefit, and the patient are going to be able to tell the difference. And if we are having problems with bags in the lower eyelid, we can use cell booster shape to get rid of this fat, to get some sort of atrophy of the fat bags, to induce apoptotic cell death with no inflammation. You can use this alone or in combination. Why I say this? Because sometimes, you know, I do lower blepharoplasty, transconjunctival, and you get like surgically, you remove the fat bags, but at some point, you know, you have some sort of edema that no one knows why is this down the road, like long-lasting edema of the lower lid, and then you can get rid of this edema with an application, postoperative application, for example, of cell booster shape. Sometimes you apply cell booster shape as your primary approach to the lower eyelid bag, and if you don't get enough results, you can use radiofrequency, such as in this picture, which is called Accutite, which melts the fat in the lower lid, okay? But the problem with Accutite is that it induces like 15 to 21 days of post-operatory or post-procedure edema. And you can get rid of this, or you can prevent this edema through the prior application of cell booster shape. So by combining the cell booster with technology, we get better results for the cell booster, we get better results for the technology, and so it's much better than using them on their own. So the main problem of this area, obviously, is that the eye is highly vascularized, so you tend to get a lot of hematomas when you are working in the lower lid, especially working in the lower lid. When you have to get to the fat compartments, you know that they're retroseptal, so you know there's a high, there's a lot of vascularity over there, and obviously you have to be concerned when you are injecting fillers, because you can get inside these vessels and get vascular complications. The problem with cell boosters is not present because you're injecting water similar viscosity products, so you cannot obstruct a vessel with this, okay? Even if you inject it intravascularly, it won't get anything going on, you won't get necrosis. Maybe you will get some sort of vasculitis effect or something like that, or some pain, but you cannot like have ischemic event with cell boosters, okay? And the other thing is that the periorbital area has very thin skin, so it doesn't hold well the edema, you know, so the skin tends to be very exaggerated of the inflammation when you do any sort of procedure, including fillers or cell boosters. So the advice is to be conservative with the amount of product that you're using. Try before your hands are different from another colleague about the how gentle you could be with this area. And obviously, if you can favor this, especially if you're going for the deep fat compartment, it's wise to use cannulas, so you would be less traumatic, okay? So here we have periorbital approach. We have this patient from Sicily, and she had obviously a lot of hollowing in the lower lid. She had some sort of hyperpigmentation here. So we did an overall rejuvenation of the periorbital area. We enhanced a lot, you know, the hollowing of the lower lid. We erased a little bit the the eyebrow, and she looks a lot more rejuvenated. You know, we work a little bit as well on the nasolabial folds. That's why she looks so much better, so much younger. And when you are promoting, you know, periorbital rejuvenation, it's just, you know, like the patient is going to look so much younger because of that. This is another case. She looked very tired around the eyes because of all these superficial wrinkles she had. And, you know, obviously you cannot feel the superficial wrinkles with hyaluronic acid, because even, you know, people that work for the bigger companies of fillers, that they put their faces and to the big names of aesthetic industry, and they have done, you know, workshops on their faces during the big congresses, they have problems with fillers. You know why? Because of down the road they always experiment, you know, edema on the lower lid. So it's very unwise to be filling, you know, superficial wrinkles around the eye with fillers. So that's why it's so much better to be treating this superficial wrinkle with low viscosity products such as cell boosters. You can have a very important rejuvenation when you combine deep filling, like in this case, deep filling of the lower lid with superficial rejuvenation with cell boosters. Here we use lift, and we use as well glow, and the whole face looks so much nicer and shinier and much more, I would say, healthy. So when we combine cell booster with surgery, I know that not all of you are doing surgery, but it's good that you have a relationship with a surgeon, and maybe you can work before and prepare the skin for their surgeries, or to receive the patients after the surgery to enhance the healing of the surgeries itself. So that's why we are going to talk mainly about 3 surgeries that we combine cell booster with. One is the hair transplantation, the other one is the facelift, and the other one would be radiofrequency, surgically or non-surgical radiofrequency. So when we combine cell boosters with surgery, or we combine surgery with cell boosters, we can use it before or after the surgery, okay? Mainly we want to prepare the skin for the damage they're going to be expecting after the surgery. That if we know at certain time that the healing gets some sort of delayed, or you have some problems with the healing, you can totally use it as well after the surgery. You can prepare the donor site, for example, in hair transplantation, when you have problems with the hair state or the hair health, and or when you have very inelastic skin, or smokers that will have problems with the surgery. So whenever we are talking about hair transplantation, for example, cell booster hair is an excellent option to prepare the hair for hair transplantation when we have very thin hair, and when we have reverse alopecia or advanced hair loss. So you know that, you know, when we do hair transplantation, we extract hair from this like posterior part of the scalp, and when you have reverse loss of hair, you tend to lose, you know, not just, you know, the average androgenic alopecia, that you tend to be losing a whole canal from here towards the backward part that includes the donor side. So when we have this advanced hair loss, we know that we have to prepare the scalp and prepare the hair for the harvesting and further or posterior transplantation. When you have an active loss, it's unwise to do a hair transplantation, because you have something that is called the shock loss when you harvest the hair and you transplant it towards the anterior part mostly. Because of the stress of the surgery, you know, this hair is going to get lost, and the stem cells within the hair shaft are going to make, you know, the new hair to grow. But when we use before cell booster hair, this sort of shock loss is reduced. You don't lose all the hair, and actually some of the hair stays after the transplantation. So these are cases when we have used both. We have used cell booster hair to prepare the scalp, and then we have used, you know, hair transplantation to enhance hair growth and augment, you know, hair density. It's not just about the amount of follicles that we are improving. It's about the density and the thickness of the follicles that makes the hair looks like tougher and harder and stronger. Okay, even if you are trying to pull them apart, you know, after the application of cell boosters, they get attached much better to the scalp, and it's hard to remove it from the scalp. So same as before, I like 4 sessions. In this case, I prefer 4 sessions with 1 or 2 vials, depending on the area to be treated. And we want to prepare the scalp at least 6 months before hair transplantation, especially in advanced cases of hair loss. And obviously, you can use it as well as a maintenance after the hair transplantation. We tend to promote 4 applications, and then in one time, in 4 months, mainly one per month or 1 every 20 days. And then after hair transplantation, we try to promote it once every 6 months, so twice in a year. This is another case where you can see that we have done some new hair transplantation in the anterior hairline, but also, you know, like by injecting cell booster hair, we get better density. The hair looks even like more ordered in the pattern of growth, even though we only transplanted the anterior hairline. So when we combine cell boosters with, say, facelift, you know that depending on what country you are, you know, facelift is a procedure that are asked for people around 65 years old and older. That's in Italy. And in Latin America, you know, patients, they look for a facelift after 40 years of age. So the difference in between where you're working and what your patient will be asking is very different because of the culture. So if we are in Italy or in Spain, and you know that people, they love just sunbathing, and they will come for a facelift after 65 years of age, you know that the skin might be pretty damaged, photo damage. So the healing would be very poor. The scar is related to 2 items: the skin tension that you put in the flap that you will be lifting, and the other thing is the skin quality. You know, and one of the things that can affect your scar is skin quality of severe inelastic or photo damaged skin. So it's very wise to prepare. Just you can do some lifting with this product, and you can prepare the product for a facelift 3 or 4 sessions 1 month before the procedure. The only problem may be that once you apply this product, maybe the patient, they don't need a facelift anymore. Okay, because we have seen a lot of almost surgically results with cell boosters technology. So the other thing is that this is a case where we apply, you know, facelift, and we apply cell boosters as well. And you don't just get, you know, the tension over the skin, but you also get a skin improvement that looks shinier, healthier, and younger. Okay. So one last thing is that when we combine cell boosters with radiofrequency, okay, when we are talking about radiofrequency, I talk about Morpheus, like here, which is annealing of radiofrequency. I know that there are many companies that have this technology, and I like it a lot because you can use it all around the year. It doesn't induce hyperpigmentation, and it will enhance the first 7 millimeters of the skin. And also Agutite that I showed you before in the lower eyelid or face tight. So you can apply this on its own, but obviously when you apply it combined with cell booster, you will have enhanced result because you will be stimulating collagen regrowth with all the chains, all the ingredients already present in the skin. So one thing is to start from zero, like to plant a seed in the desert, and the other one would be to plant a seed in the Amazonas or Brazil, which rains every day and has a lot of sun, so the plant will grow much stronger and faster in the Amazonas. This is the same concept, okay? If you apply your technology combined with cell boosters, you will totally get better results because all the ingredients that you need for the healing will be already present over there. So decrease downtime, and I like to use the 3 products depending on what intention you have. Obviously, if you are treating the abdomen because you want to get rid of some fat and compact the skin, you can use Shape. If you want some lifting, we already discussed, you could use CELLBOOSTER Lift. If you go for some rejuvenation of a very young skin, or to get an even pigmentation of the skin, you can use CELLBOOSTER Glow. And I like 4 sessions, 1 to 2 vials, 1 month before the application of radiofrequency. So this is a case that I really like because it was something that mixed a little bit everything together. It has a very important stretch mark, and we did an abdominoplasty, a mini abdominoplasty with umbilical lift here, and she has a very bad skin quality. Okay, so obviously, you know, these scars, they don't come up so well because of the skin quality, and she has all the stretch marks that you can possibly have. And we have been applying radiofrequency needling to get rid of the scars and to get rid of the stretch marks. But when we did that on its own, what happened is that because the skin is very poor in quality, you know, the overall improvement with one single treatment of radiofrequency needling wasn't enough, wasn't good enough for me. So I started like combining with cell boosters, and I have started getting better results because you ask for what the skin has already inside it. So one thing is to try to camouflage something, and the other thing is to try to heal the skin from the inside. And that's the main thing that I like about these products, is that they allow you to heal from the inside, to truly rejuvenate the skin. And you can combine them with any technology, with any surgery, because it will make your life better. It will make the results better. It will make your patients happier. And it's not expensive. It's something that all the patients can tolerate to spend if they want to get a better result. Well, that's mainly the presentation of today. I think we were just in time about what they asked me to be, around 45 minutes, so we have some time for the questions. Okay, so I have one question here. I want to, they asked me if I use 2 to 4 vials of Shape in one session. Yes, it depends. Maximum that I use is 4 vials. But the thing is, depends on where you're working. If you're working in the V-shaped fat pad, you know that 1 vial will be in each side, okay? And 1 vial can go in the chin. And that, I would say that that's enough for a facial session. If you're using it for body, I would say inner thigh, love handles, or you know, the accumulation of fat in the pectoral area in men, you can totally use 2 on each side, and it will make the difference. If when you are using Shape for the body, you have to be in 4 vials per session to get a very good result, and to combine it with physical exercise. When you're using in the face, it's better to stay maximum with 3 vials. Okay, 4 bags. How much of Shape would you use to inject under the eye? Okay, if I use this product in the lower lid, then what I will say, it's I would use, you know, the 0.3 insulin syringe of the VD company that has a 32 gauge needle, very short, and I just use 0.3. Okay, you know that in the lower eyelid you have three back compartments, would be medial, medium, and lateral. So obviously the main component is the medial. Sometimes you don't have anything in the lateral. Sometimes you have very little in the medial. So you have to be able to analyze your patient up front before the treatment. And sometimes you have asymmetry. Sometimes you have a bag that is more important than the other one. Generally speaking, if you want to be doing any analysis and have a smooth result, you can inject 0.1 ml of product over each bag, deep down here. So medium, medial, lateral, 0.1, 0.1, 0.1 would be 0.3 overall, okay? 0.3 overall, so you'd be injecting 0.6, 2 of the small syringe that would be enough, yeah, for one treatment. See what it does, and then make your patient come back after 3 to 4 weeks, and maybe you can repeat that again. So I have another question here. What is the rejuvenation procedure for dry and inelastic skin? How many sessions? How much every session for the face? Okay, so as I told you before, if you have dry and you have inelastic skin, it depends on the age of the patient. If the patient is 55 or below, I would go for the Glow product, okay, Glow, Cell Booster Glow, and I would be injecting, because the Cell Booster Glow has to be injected very superficial. I inject only 1 vial per session, okay? Because I do some sort of clustering in the forehead, I do some clustering in the periorbital area to get rid of the wrinkles, of the crow's feet over here, and then the rest I will be injecting as a regular filler is the nasolabial folds, as you saw in the video. And because the skin is dry and inelastic, is mainly due to two conditions. The first one is that the water ingestion is low. The other thing is that the nutrition is poor. So you have to advise those things as well. The patient has to be supplemented with vitamin E orally. Sometimes I use omega-3 as well orally, and I enhance the amount of water that they are taking every day. Sometimes I also supplement my patients with external collagen products because I think that nurturing your skin from the outside and from the inside with the nutraceuticals is very important, as you can get a better result. So the question would be, how much ml per session per face? If you're using Glow, I would go with 1 vial. If your main issue is skin hydration, I would go just with 1 vial of Glow, and I will make the patient come back after 3 weeks to do a second session, 3 weeks, and a third session, because hydration is something that is related with a lot of factors: nutrition, hydration, and skincare. Okay, so I have another question here. 3 to 4 sessions every 4 weeks is reasonable, or closer is better? Okay, so I told you that total, you should be attempting to put 3 to 4 vials. Okay, this is one of our goals, is to be delivering 4 vials per area that we want to get improved. So you can split these 4 vials in 4 sessions or in 2 sessions. It's up to you, and it's up to your patient's tolerability. Okay. What I have seen is once you get 2 or 3 vials going inside the skin, you get to see the results and the patients are happy. So because my goal is to make my patients as happy as possible and as fast as possible, I almost always start with two vials of product in 1 session, especially when I'm doing shape or when I'm doing lift, okay? Because there are more deep injections that are more tolerable. When you are injecting hair, or when you are injecting Glow, because the injections are more superficial and the sort of injection or type of injection is more like a micropapule, you have to be delivering a lot of shots in the face and the scalp. So it's very hard that your patient will tolerate more than 1 vial per session. So hair and Glow, I would say 1 session per 1 vial per session would be enough. Okay. And it's up to you. It depends on how busy is your practice. Okay. I do a lot of surgery. I do a lot of aesthetic medicine as well. I don't have the time to split as much the treatments, and my patients are very surgical oriented. They want really fast results. So that's why I tend to apply fast forward results on my patients and to compress a little bit the protocols. Okay. But obviously the company would advise you to do, one vial per session, and to split it every 2 to 3 weeks, and to be accumulating a total of 4 vials. That would be the wiser advice. If we have any questions that I haven't answered. I'm checking this. I think we have done it all. If you have any other questions, I'm happy to answer them. How long should be the term? I think I have answered all the questions. So if you have any questions or not willing to ask, you can totally contact me through Instagram, Sebastian Torres MD. You can send our questions to sucell.pro. They can send it to me as well. And I hope to see you very soon in the following congresses. Very, very happy that the globe is turning to normal regarding the congresses. So nothing more. I just have to thank you to give me your time. Would you mix that with PRP? Yes, you can. I don't really see, a reason for mixing it with PRP, because with actually I get better results with cell booster hair than with PRP, because I never heard about like repigmentation of the hair shaft with PRP. But with cell booster, I did have some cases that start, like building pigmentation again. So that's why I get a better result, and I have an overall improvement of 85%. So you can do it. I don't think you're offering anything above the table for your patient, because you have to take out blood and centrifuge it and so on. So I think that cell booster hair is coming to the market, and it would replace a lot of the platelet-rich plasma usage at the moment. Okay, so I think we are done. Thank you everyone for being here today. It's been a pleasure once again to present you some innovations, some new ideas. This is a brand new product, brand new technology that has a lot of potential. So I invite you all to treat it and to try it, because your patients will tell you the difference. They can tell the difference from the first application, and it will enhance, of course, your clinical outcomes with all your patients. Okay, thank you very much, and see you very, very soon.